And we're live. Welcome to another Comp and Coffee. My name's Russ, and today I'm joined by Bill and Matt. How are you gentlemen doing today?
Good. Doing great.
Good and great, despite the recent changes. Have there been some changes?
I wasn't sure much had changed in the past several weeks. Is there anything going on? What's going on?
What is going on, Matt? I feel like we could just take survey data from like December 2019, age it forward a few months, and everything be fine, right? That seems okay.
Except for maybe a small pandemic.
Yeah, just a small one, right? Matt, how has it been sort of affecting some of our clients? Have you been having any outreach from them on this topic of COVID and what's going on there?
Yeah. I think we've had a few clients reaching out over the last month or so. Things are definitely different. We've been hearing from people in all different industries, and it's different from industry to industry. I think, Russ, you've probably seen that as well, too, with some of the things that we've been doing. But people basically have been coming to us just looking to get questions answered about how COVID is affecting each industry. So I think we've done a lot of great things that, to help with that. And basically our clients have volunteered and have, put together some groups. Russ, I know you played a huge part in that, so I don't know if you want to touch a little bit on what we've been doing at Payfactors to facilitate that, I guess.
Yeah, well, clients were definitely reaching out and asking that question. And Bill, I'm curious about you've been in this sort of space for a long time. And one of the things that I think when you see something challenging like this is, how do you feel about this idea that people just want to communicate, right? They want to connect and talk to each other. When a time of uncertainty, that's the number one thing you can do to sort of gain some confidence. Has that been your experience over the years?
Yeah, definitely. And there's a few things that seem to always happen. One is the obvious, obvious observations, not really the way things play out. And a lot of people are facing the same issues you are. And just knowing that you're not the only one having this problem, whether the problem is, how do I deal with sending all of my employees or most of my employees to work from home, or the uncertainty of the future? Like, other people are having those same issues, and some of those companies are the ones down the street from you, and some of them are the ones that are in the same industry as you. And while yes, the people in the same industry are often competitors, they're also peers and collaborators, and just being able to talk through how to do these things is educational, useful, and comforting, I think.
Yeah. I love the comforting part. I think there's like something cathartic about just, what's the old saying? Misery loves company. And so it's helpful to kind of talk. And to Matt's point, so clients started reaching out to us and saying, we just want to communicate with folks in the same boat as us. And so Matt, you mentioned this, and we thought, well, might there be a way to sort of connect some of our clients with each other? And Bill, you mentioned this. Every industry is a little different, right? So what if we were able to get together virtually, get a bunch of folks, compensation leaders and HR leaders from all these different organizations in a specific industry, and instead of sitting down with them and saying, we are experts, here's what you should do in a time like this, because quite frankly, this is an unprecedented time. None of us were alive during the Spanish flu. So how do you tackle this? And really the answer is that we thought was, well, let's just let folks talk. Let's get everybody together online. Let's facilitate a discussion. Let's think about how can we have a meetup, a virtual meetup of 40 or 50 people, but still have it feel like you can talk one-on-one. And so we tried this approach with breakout sessions. We got clients together from an industry and some folks that weren't even Payfactors clients, just folks who were in compensation and wanted to talk. We didn't want to limit this just to clients because we knew now's the time.
Right.
So this wasn't really about Payfactors and our clients. It was more about how can we facilitate communication in these different industries amongst comp professionals. We know we're dealing with all these crazy challenges. So we got everybody together. We did these breakout sessions where we'd let the participants vote on a topic. And then for 10 minutes, we'd break out into small groups, 4 or 5 folks per group. Those folks would talk for 6-10 minutes or so on the topic. And then we'd reconvene, and each group would pick a leader to share what their group spoke about. So in this way, the entire meetup could hear all the different discussions that were happening in small groups, but you had that moment to just talk with 2 or 3 or 4 people which is much more like sitting at a dinner table, just sharing some of the challenges and some of the ways you and your organization are responding. And I know, Matt, you were on a lot of those calls with me. What was kind of your feeling as they were progressing about that format? How do you think that worked out for the clients?
Yeah, I mean, I feel like they really enjoyed the format. You touched on a few things there, Russ. You were talking about basically they built the agenda. We polled them and we asked what questions they want to get answers to. And from my perspective, actually, I've joined a few different webinars from vendors that we work with, other folks in the customer success space. I've joined more webinars than I think I ever have in my entire life in the last 30 days. So I have a new perspective on all this stuff, but the ones that I really enjoyed were ones where the vendor or whoever the partner was came to me beforehand and said, all right, what are the top 3 things you're looking to get answers from your peers about, opposed to those folks that said, here's what we're going to talk about, here's the agenda, and basically having them dictate what you're going to learn. So I think the folks that you mentioned that joined these different breakout sessions that we had within different industries, Payfactors clients, non-Payfactors clients, I think what they really found useful is that we allowed them to build that agenda, and it's changing too. And I think we can't just go with a set one with each one of these meetings, from industry to industry, from week to week, things are changing so drastically. So if you talk to me maybe 4 weeks ago when we did our first one of these, the questions that we're asking and answering are completely different than the ones that we're getting today, where people are starting to get back into the office. And I think we'll talk about that today too. And they're looking to answer questions about, getting people back into the office, taking temperatures, all those new sort of things that they've never had to encounter before.
Yeah, I think that's right. And I think one of the things that made us feel pretty good about this, we did one of these and we really didn't know, if this would be helpful or not. You want to be mindful of everybody's dealing with so much. And after the very first one, folks kind of said, hey, can we do this again? This was really helpful. Can we meet more than once? And so that's when we kind of knew that this was helping, and we wanted to do more of it. And then we thought, well, since it's helping in these little meetups for each industry, wouldn't it be nice to share some of the things we talked about and we discovered in these meetups with listeners like yourselves? And so that's where sort of this led to. And Matt, you mentioned something which was interesting, was we tried to, part of this was we didn't really know for some of these meetups what we should cover. And so as part of the invite process to come to the meetup, we also sent out surveys to participants. It says, hey, if you're going to come, can you just answer a few questions? And some of these questions were open-ended and some of them were quantifiable to kind of see what was going on, and thought it might be kind of fun to share some of that information with you guys too today. Bill, looking through some of the survey responses, what were some of the things that you found sort of surprising or maybe not surprising? What sort of confirmed some of your hypotheses about what's happening out there, and what were some things that surprised you a little bit?
I think some of what surprised me, I sort of alluded to this a minute ago, or a few minutes ago at this point, was that what you expect to happen isn't exactly what happens. Like one of the groups that we talked with was healthcare, and healthcare. Everybody thinks, well, healthcare is booming right now. I don't mean that. It's sort of a weird thing to say that they're booming because there is a pandemic, but they are super busy. We all know that. But that doesn't necessarily mean that the business of healthcare is booming and that they're having a lot of problems because, they're limited in what they can do. A lot of places, all they're dealing with is absolute emergencies and COVID-related things. All elective procedures are being put on hold. So it's not like all healthcare organizations have money flowing through. And so they're having challenges if they have people working all the time, almost literally 24/7. But that doesn't mean that they're printing money, and so they have challenges just like other industries. And then, you have industries like, transportation or airlines and, hospitality, which, sort of hit like a virtual cliff where they all of a sudden, in a state by state but short kind of rollout is, the travel industry just kind of got put on hold. And so you've got all these organizations being challenged as to how to, maintain their business while they have no customers. And then, of course, that rolls out to everyone else. And so you've got all these challenges of people not knowing what to do and how to do it when they're running the organization, or HR people not knowing like how to manage their workforce comes out of this. And so I think those challenges became, interesting, and you start seeing companies doing different things as a way to address those needs. You start getting into having people working on different kinds of things than their normal jobs. It's sort of the obvious one that everyone hears about is, in hospital situations, you've got basically, regardless of the kind of doctor or nurse you are, you're working on something related to COVID and, triaging patients and, doing blood tests, doing various things, because that's what the primary function of the facility is at that point in time, and that everyone has to be reassigned.
Yeah.
In other businesses, it's not as obvious. I don't know if you guys have good examples top of your head on that.
Well, I want to get to the reassigning of staff because I think that was a big topic that came up quite a bit. But I also wanted to ask a little more. You said a bunch of interesting things there, Bill. One of them was when we looked at the survey data, sort of like this idea that there were some unexpected things. And one of them was, we found out kind of early on, kind of before it hit the news, that healthcare was looking pretty seriously at furloughs right from the beginning. And one of the things that surprised me a little bit was when we looked at our data, we compared the results of different industry meetups, and we saw that healthcare was considering furloughs more than airlines. But then we talked to hospitality, and we found that they were furloughing so rapidly at hospitality that one of them, you kind of hinted this too, Bill, like the compensation folks trying to manage everything very rapidly. They were furloughing so fast in hospitality that they furloughed the furlough team in some cases. And then all of a sudden, who handles that work? But then you look at airlines and they weren't furloughing. And Matt, did you remember that conversation? Like, do you remember why airlines was kind of like thinking differently about furloughing compared to some of the other industries that were hit just as hard?
I know that from the airlines conversations I had when we did that virtual group, they were talking about different ways to keep staff. I mean, they're still flying, just not as much, but they're trying to find ways where they don't have to furlough and they don't have to lay people off. There were many things that they talked about, including like voluntary vacation and time off at that point to sort of get through some things. But I think the biggest thing that came up during the airline meetings is they were waiting to see what was happening with the government aid.
That's right.
And looking to understand what's happening with that, when it's going to hit, who's going to be impacted, whether they should actually accept it or not. Because I know some of them were thinking, with all the rules and regulations tied to it, should we be accepting this? So that came up in that meeting, as well as other ones where, maybe small to mid-sized businesses as well were doing their best, which is tough. They're doing their best to try and keep up with the changes that are happening on a daily basis. I mean, if you listen to the news every day, the different, the changes that are happening on a daily basis, and understanding the government aid can be difficult for anyone, especially, someone in HR is just thrust into this position of understanding all the implications and dealing with layoffs and furloughs and all that sort of stuff. But I was impressed by, our folks in HR who are doing everything they can to prevent doing any sort of layoffs and furloughs.
Yeah, they were working really hard at that. And you're right, they brought up, what was interesting was we met with the airlines kind of early, and they remember very well 2008 and some of the government assistance that happened there. So they knew they were getting something, and they also knew that would be based on whether or not you furloughed people. And so the airlines were going in with this idea that if we furlough now, we may put this assistance at risk. And so they wanted to wait and see. And one of the big things that come up in the polls constantly was and is, how do we keep track of all the rules and regulations, right? I mean, first of all, there's the federal aid rules and there's the PPP rules and everything else going on right now. But then there's also the state and local rules that are changing, feels like daily, around the process and procedures you have to do, or can you even be open? And then the process and procedures you have to do around that. And one of the anecdotal evidences I thought was kind of interesting is one of our clients, their corporate headquarters are down in Texas, and their corporate headquarters is literally on the county line. So half the buildings in one county and half the buildings in the other county. And in Texas, apparently the county judges have a lot more authority than maybe in other states. And so they literally have different rules about going back to work and being in the office inside their same building. So think about having to manage that kind of stuff.
Do they have to tell them which door to come in?
Actually, funnily enough, some clients said they were doing that. And we'll get back to this when we start talking about, a lot of clients started talking about, maybe this is a good segue to talk about some of the big topics client wanted to discuss. But when they started talking about getting back to work, one of the clients actually said they were grouping their employees up by teams and having different teams coming different entrances of the building to, from this client's point of view, it was just avoid just that much less contact with people. But I'm guessing this Texas client might be doing something similar.
Yeah, it is. I mean, the whole sort of the patchwork of rules and regulations is another challenging issue. And I think it probably doesn't catch the people that are impacted as much off guard as it catches other people that are either involved or elsewhere. Like, if you are, a big retailer, a big, hotel chain or something, and you have locations in all 50 states or lots of states, lots of different counties, you're used to dealing with things like the different employment rules, different minimum wage rules and all that. And you're sort of aware that you have this whole cascading problem. But if you're in an organization that's just got 2 or 3 locations, the idea of keeping all the local laws in mind sometimes catches you off guard. And it does make a big difference when you find out, if your primary location is in the Midwest, in St. Louis, say, but you have an office in Manhattan, and all of a sudden to be told your employees can't go to work in Manhattan anymore.
Right.
It's like, what do? Your HR in St. Louis, time for your head to explode. And just people understanding that's you got to deal with it and be in this kind of environment, making the best effort is sometimes the best thing you can do. And for the most part, nobody's going to give you a hard time for doing your best, even if it's not exactly to the letter of, the law, and the laws are a little murky anyway. We're, seeing that in all different kinds of things. All that stuff though seems to have somewhat mellowed out. I don't know if you guys agree with that, but it's sort of like there's more, parallels between what different locations, different governments are doing and how people are dealing with it. And things are starting to look similar from one place to another, even though, some states are now opening and others aren't. But at least, you can see the ones that aren't are going to start following at some point. And we don't have any special insights into when.
Right. Kind of interesting though, when you think about, keeping track of, let's say, if you're a retail organization, keeping track of all the different sales taxes in various states. Imagine having to try to keep track of all the different opening dates and the kinds of procedures you have to follow. If you're like a nationwide restaurant, imagine having to try to track all the different rules in every state. Some is only outdoor dining. Some of them you have to wear a mask. Some you don't. Some it's every other table.
25% of the occupancy or
right.
Whatever. But and that's what I meant by people that aren't directly involved in that stuff. You don't think about it. It's like the sales tax and the payroll tax, all that stuff those systems have been in place for years. And yes, they change a lot, but right. Your payroll provider, your lawyers, all of your support network is familiar with that. And so you have a system for how what the rules are and when they change.
Right.
But this is all new.
Right.
Nobody has a COVID advice team that's helping them, or a pandemic advice team that's helping them with when you can reopen, how you can reopen, what you do. And, does it change, county to county, city to city, those sorts of things. And I think that's, kudos to all of the HR people, operations people, and such that are actually getting this stuff done.
That's right.
It's a lot.
And so they're dealing with all that. Oh, sorry, go ahead, Matt.
I was going to say, I think one thing that we're even somewhat overlooking that came up a lot in these meetings, and Bill, you were almost hinting at it there, is that then they need to take all this information and they need to communicate it out to all their employees in a clear, concise way to all them, because their employees don't understand, all the differences and rules and regulations from state to state, wondering when they're going to be going back, how that impacts them, how much of the office is going back. And your last point that you made, that no one has a coronavirus team in place prior to when this happened. So they had no plan about how to communicate this out with pandemics to all their employees, and they're thinking on the fly. And that's something that just came up a lot in sort of every industry. Is the number one thing that people were looking for is, how do we communicate all this stuff out to our employees? What's the best way to do this? Should we be sending daily email updates? Should we have an internal intranet site that we can post all of this stuff? Are we mailing out stuff to people? All those sort of things that they never really had to think about before a pandemic hit.
I think that's huge, and I think that is a thing that comes up a lot, and I think it's worth focusing on a little bit more, is that the employees are kind of, particularly the ones that are working from home or working remotely, they're sort of disconnected more than they ever have been before, and they yearn for information. And I think what happens is, if you think of your organization, whatever organization you're in, there's lots of conversations about what to do and how we're going to do this and how long people are going to be at home. And that's all happening kind of in the upper echelons of the org chart, and it's happening like multiple times a day. But the employees who it's affecting are sitting at home hearing nothing. And so even updates that say, we don't know what's going to happen, or we don't know when we're going to bring you back to work, or we don't know what it's going to look like the communication that says we don't have an answer for you is pretty valuable to those employees.
Yeah.
And you can't underestimate that they're, I think I've used this before on Comp and Coffee, but it's like, speaking of our friends, the airlines, you're sitting on a plane, and they shut the door, and you're just sitting there, and the plane's not moving, the engines aren't running, and you sit there and you start wondering, well, why are we just sitting here? Why hasn't the flight started? And people get agitated. But as soon as the pilot or co-pilot comes on and says, we have an issue, we've got some paperwork, it's going to take 45 minutes, and then we should be good. Like, once they tell you what's going to happen, or that they're aware, that you're sitting here wondering what's going on, you get much more calm, and, you go back to reading or, listening or watching, whatever you were doing. And that's what your employees are like right now, without any communication from HR, from corporate, from the CEO, from whoever. They're sitting there going, when's this going to end? How does, am I ever going back to work? Whatever. Have they forgotten about me? And of course you haven't, but, recurring reminders that we remember you exist are important. And, you definitely hear a lot of that from all of these, organization leaders that we've been talking to in all the different industries.
Yeah. And I think that came out also of our survey. We asked specifically, how often are you communicating? And the vast majority were communicating daily. But then we did hear a lot of really interesting communication techniques that Matt mentioned. One other thing that came out of the survey is a nice segue into maybe some of the topics that we actually broke out and spoke about. So one of the things we asked in the survey is, what is something we can do to help? We meaning Payfactors. And one of the things folks said in the most recent survey, Matt, you haven't even seen this one, which was advocate against hazard pay. And I was like, ooh. And so this is a good segue into some of the topics we broke out and talk about, because by far one of the number one things everyone wanted to talk about was this concept of hazard pay. And really the two industries that really brought it up a lot, surprisingly not the airlines, it was actually retail and healthcare that brought it up a lot. And Matt, do you remember sort of what the thinking is? Because almost every client said, this hazard pay thing, I know the media's talking about it, everybody wants to do it, but I don't like it. What were some of the things you can remember our clients talking about and participants talking about why they were so concerned about this concept of hazard pay?
Well, first thing would be the name hazard pay. That was pretty consistent across the board that organizations were not using the term hazard pay, even though, like you mentioned, Russ, it's on the news every day, people talking about that sort of stuff, but hazard pay has a bad connotation to it. Excuse me. So I saw all different types of names for what we would call hazard pay: surge pay, premium pay, auxiliary pay, additional rate, all that sort of stuff. So people were using those terms when describing them to employees. Not everyone had done it. One of the biggest things people were focusing on was sort of when to put a deadline on it, because they didn't want this to be a permanent thing. So a great idea that I saw from someone in healthcare is that when they rolled this out to folks, they put a deadline on it it could have been like May 18th or somewhere around there. And their idea was, we'll put an end date on it. And if we get closer to that end date, of course, if conditions are still poor, that we can extend that out. And if we still need to have people on here, then we can extend the date. But if you don't put an end date on it, then people are just going to take this as the norm moving forward. So once we get through coronavirus, people would still think that they would get this auxiliary, this premium, this additional rate pay. So that was one of the biggest things that I saw as well.
That's exactly right. I thought one of the fun ones was one participant said, we call it thank you pay, and you can use that. I thought that was pretty good. Because the big concern in healthcare
Did someone say thank you?
They did. Actually, a lot of people started taking notes, because the big concern in healthcare is, nurses, by definition, part of their job is working in a hazardous environment. And so one of the things they talked about was, well, so you got to be careful, because how do you end this thing?
All pay.
Right, all pay. And so then it was, well, maybe if they don't have enough PPE, maybe if they don't have enough protective gear, that kind of thing. If they're not operating by the book, then that would be hazardous. But if everything's by the book, then it is what it is. But I thought it really interesting that perception, which I think is correct, which is make sure it's short, make sure everybody knows this is something directly related to this pandemic, and that it does have a very clear end date, which I thought was interesting.
It's funny. It raised in my mind. I had never thought of it before, but the term hazard pay, I'm shocked that. I mean, that's an industry term, and I'm shocked that it's been around for 40 or 50 years. And that no lawyer, nobody has come out and said, let's not call it that. Like, we don't want to be declaring that we're putting our employees in harm's way.
I'm literally paying you risk.
It's funny.
Right. I'm literally putting your life in jeopardy.
I mean, it's true, but yeah.
Yeah. And that jeopardy is worth an extra $2 an hour. That's what I'm saying.
I think the other thing that came up, though, in healthcare, though, is that it's not hazard pay. I mean, these people are doing an amazing job right now and fighting coronavirus and helping people that are sick. This is part of their job. While things are increasingly worse for them right now, a job within a hospital is hazardous by nature.
Yeah, I think that's right. Another thing that came up a lot. So hazard pay was by far the number one thing people were talking about. But right behind that, another topic that always got voted on, that we always spent a few minutes on working out in the breakout sessions, was reassigning staff. And so, Bill, you mentioned this earlier, this idea that, when demand shifts, how do you tackle that? One of the things that became sort of complicated for this, and I'm curious what you guys think about this, was this idea that, well, how do you compensate someone that's working in a lower role? So if you reassign someone to a lower role, do they get a pay reduction? Do they just work at their normal rate? And then what if you're taking an exempt employee, someone who's in an exempt role, and you ask them to work in a non-exempt role? How do you handle that? Do you pay them the overtime? Do you not pay the overtime? What do you guys think about that challenge?
I'd be curious as to what our community members thought about that. There's sort of the by the book legal answer, which is, you're only working in an exempt role as long as you're doing exempt work. So, when I move you from being a CFO to taking people's temperature when they walk into the building, like, that's going from exempt to non-exempt. That's clearly not the purpose of FLSA and sort of all those rules. And so I imagine that most people like are approaching this like hazard pay, sort of like a wartime kind of effort. And it's like, everybody needs to to pull together and do what needs to get done to accomplish our goals, our mission, whatever it is we're trying to achieve. I'm giving an absurd example, although I'm not saying it's absurd for a CFO to take people's temperature, but if I am that CFO, I think I would probably rather collect the CFO salary than collect the temperature taker salary with overtime. And that's what I imagine the bulk of people are doing, and sort of let's get this done, and let's just do what makes sense. Again, you don't have a lot of time and an ability to like plan and research and call your labor attorney to see what the best approach is here. So I think it's sort of let's overall make sure that we're paying our employees fairly well to do the things we're asking them to do, and we'll clean up the mess later.
Exactly. And I think,
did you hear other things?
Well, a lot of them try to compensate in some way. So, and Matt, you can chime in here too. One of them, healthcare has a lot of healthcare organizations. One thing that's kind of semi-unique to healthcare is they have a lot of employees who work multiple jobs. So what they would do is they would just take advantage of the fact that they have systems in place already to just assign that person the different job, and then they can be paid as if they were that worker. So they were taking advantage of that. Some of them would just pay the OT regardless, just to avoid the concern. And some of them were just paying normal comp. It's like, nope, it's wartime. Do what you need to do. And so it was kind of a little bit of the gambit. Matt, any other things that you heard on that one?
It was about the same in my group. And this came up in one of the breakout sessions that I was in. And it got a little silent when someone asked the question, because everyone was like, oh, yeah, we hadn't thought about that yet. We don't know how we're going to handle that one. So I think, to like Bill's point, everyone's doing the best that they can, and you can't fault people for doing that right now.
Right. And I think a lot of them are, a lot of people, like a lot of organizations where that kind of thing is coming up, have already made some sort of decision to pay more, do more for the employees that are there doing the work. And so, like sort of what Russ was saying, it's like, they're paying them overtime anyway, even if they don't have to. They're, giving them, thank you pay or whatever term they want to use to call, for that. They're like, it's sort of erring on the side of giving people more because you're asking more of them. And so even if you're asking them to do a kind of lower level job, lower pay level job, they're not going to dock your pay because they asked you to do something different.
Makes sense. Sounds like the police are coming for you there, Bill. That's what it sounds like to me. Are you paying a little bit of overtime? I feel like you might be.
Apparently I said something wrong. It's the HR police.
Matt, let me ask you this. So one of the things that felt pretty good, though, was a lot of organizations, particularly when we did the retail meetup. It was right around the time Georgia was talking about reopening. And so a lot of organizations were talking about, what do you do when you get back to work? How are we going to tackle this whole get back to work thing? What were some of the things that you got brought up when you were in that group there, Matt?
Yeah, this was one of the more fascinating ones for me, and some great ideas coming out of that. The best thing that I heard from a few people is that they're learning from other offices. So I happen to be in a group with some retailers that have international locations. And so some of those countries are already back to work. So they're learning from what other people are doing there. And I think even in the U.S. too, seeing as it's state by state and sort of how people are coming back into this, or out of this thing rather, that you can learn from your other locations if you have them. You can learn how other people are, staggering teams, bringing them back. So a lot of folks are doing that. So they may bring, one team back 1 week, then wait 2 weeks before bringing the team that sits next to them in your particular office back. Generally, people were looking at least a week staggering between bringing groups of folks back. but up to even 3 weeks difference people were looking at. The other things that people are, planning for and implementing, doing temperature checks, people coming in, providing masks and gloves and all of that sort of stuff. But those are some of the good things that I heard from my group. I don't know if you heard anything else, Russ, on the ones that you were on.
That's mostly it. One of the things I thought was interesting, though, when they started talking about bringing back the furloughed employees and folks that had been sort of used to being departed for a little while, they didn't want to, if someone couldn't immediately come back. So they're trying to deal with this concern that just because the government says it's okay to come back, come to the office immediately. They didn't want to make it that harsh, because what if that daycare is still closed in some places? Schools are out right now. So what if you've got childcare issues? What if you just are a high-risk group and you're just not comfortable going out right now, even though states are opening up in certain cases? So what they decided to do was, rather than just say to everyone, you got to come back, they created sort of a list, a prioritized list of who they were going to call. And if someone said, I can't come back right now because I have a childcare issue or a health risk or whatever, they wouldn't tell that person tough. They'd simply move them to the bottom of the return list, giving that person more time to come back, and they just continue working down that list. So I thought that was sort of an interesting approach, being fair-minded about it, trying to give employees as long as they needed to get things back to where they can get back to work, but still keeping in touch those furloughed employees, keeping that connection live, so you'll get those people back when the time is right.
I think that that's good, and it sort of opens the door to thinking more about what the processes are and sort of the secondary, tertiary things you have to think through. Like, you both just mentioned these things, and I think that was one of the fascinating things. It's not, like, when are we coming back and how are we coming back? That's a problem and, needs to be answered. But then it's like, okay, we got to take everyone's temperature and make sure everyone has face masks. Can we get, like, the thermostats or thermometers, not thermostats, sorry. Get the thermometers or whatever, like, to do quick temperature tests as people come in. Can we get enough face masks? Can we have separators between desks where there are no separators now? And then things like, if the schools aren't open, what do your employees who have kids do? And thinking, like, through all those things, it's not just, can we make our office ready and make sure the cleaning people come by and clean every night? It's, there's a whole lot of things. It is a big system problem or systems problem to make sure that you can get the people back and that they're available and that you can actually do all the things that you say you're going to do.
Right. Exactly. So those are some of the big things that got discussed. One other thing that got discussed quite a bit in the breakout sessions, and this one, honestly, we could probably do a whole bunch of discussions about this topic, but it really was a lot of, obviously, comp folks are thinking about how in the heck do we get timely market data right now? The world is completely different. The unemployment rate is completely different right now than it was just a month ago. How do you tackle pricings right now when someone's asking you to price a job today? How the heck do you figure that out? And what's going on? And Matt, we heard some interesting things about some survey providers not being in a position to get that data soon. What did you hear about that when you were in some of the breakout sessions?
Yeah, well, I heard from the individuals within HR and compensation that, one, they're not sure they can rely on surveys this year to be able to account for what's happened, what's transpired in the last 60 days, what's happening in the next 90, however many days. But then also, you have people that are now working on coronavirus related activities. You have people that are within HR that are laid off or furloughed. So they don't necessarily have the capacity to participate in all their normal surveys either. So people are trying to find ways to get reliable data with less resources too. So, a bunch of people talking about just taking 2019 data and aging it forwards, which is a difficult process to try and figure out how you're actually going to age that data. But, people looking for alternative methods for data. Shameless plug, I know, but we also have a number of folks that are going to be using our peer data because that data is going to be slightly more reliable than what you would find with surveys this year.
Yeah, it is, and that's something a lot of the folks are talking about that. And the other thing that's interesting too, and Bill, I'm curious about your thoughts on this, is that currently under DOJ guidelines, you have to wait 90 days to be able to look at any kind of market data. And given that the world changed in less than 30, is there any kind of room there? How do people get more current data when things are completely different just 30 days ago?
Yeah, it is. I mean, it is a challenge because and I think there's probably varying levels of knowledge or awareness of this Department of Justice issue over compensation data, but there is this, what people refer to as the 90-day rule, is you can't have data that's more current than 90 days old to keep you safe from the presumption of anti-competitive price fixing behavior. But if you look at even today, you look at data that from 90 days ago, that's still before any of this stuff happened. The 90-day rule, just to be clear, is not a rule. It's a guideline. It's a safe harbor. As long as the data is not 90 days old, you're presumed to not be involved in price fixing. It doesn't mean that you're not doing it, and it doesn't mean that you have to follow it. But the general consensus among our world for the past, I think, 25 years, since the mid-90s, 96 or whatever, when that became a guideline, is that every industry follows that guideline, that safe harbor guideline, even though it really refers to nurses in Utah, I believe, and the healthcare industry. It's generally perceived to, everybody adopts that as, if we all do that, we're safe. I think that there will be some push to get that relaxed for issues like this. I mean, I think the world of data has changed quite a bit since the 80s and 90s, when that was an issue, and that data flows much more quickly and it's much more broadly available to all parties. And therefore, you don't have any kind of competitive advantage, which is what the whole ruling was about, is keeping companies from having a huge information advantage over their employees. So we'll see. I mean, I don't anticipate this is going to make it to the top of the Department of Justice's list of things to look into, but it could, because there are that's an ambulance.
What did he say now?
Yeah, here they are. They're coming for you, Bill. They hear what you were saying about DOJ compliance.
It was a bunch of black Suburbans.
That's right.
The DOJ showing up at my door.
That's right.
If I disappear suddenly. So I do think that there are, now that there are a lot of industries and sort of big players, if you will, in those industries that are somewhat hamstrung. They get their hands tied behind their back around getting good data so that they can make good decisions. And let's be honest, not all salary data is going down right now. Some of it is going up. It's not, it's not a one-way street. Mm-hmm. And so there, organizations are looking for the right information, how to pay people correctly, fairly, what the real market is, not what was the market 6 months or a year ago. And so, I mean, to the extent that this becomes an issue, it will be, I think, good for the industry, but we shall see.
I think you bring up a good point too, Phil, about salaries. Not everything is going down, but also, something that came up in a lot of these meetings too, from sort of the forward-thinking people is, once things begin to normalize, once hiring freezes stop, once furloughed people are brought back, there's going to be an insane talent pool that's out there right now. And so many of the people that I was talking to across industries were worried about, losing their talented people, because there's going to be other organizations hiring and hiring for, higher salary rates and that sort of stuff. Right. Or if you've laid someone off and you'd like to, you're thinking that maybe I'll be able to bring them back once business gets back to normal, you might not be able to. So I think people are concerned about that as well.
I think that's a huge issue for people, because I think that it's important for the compensation HR people to remember that this is not like an economic downturn or recession like anything we've seen before, or at least it's not anticipated to be like that. We have ridiculously high unemployment filings, part of which is, because they broadened the definition of who can file for unemployment. That's another podcast. But also because it all came so fast. But just like it showed up so fast, it's likely to end much more quickly than previous recessions, depressions, or whatever you want to call them. And to Matt's point, you got to be careful of your competitors coming back faster than you do and starting to hire those people that you laid off or furloughed. The people, like, there's some people that you may have laid off because you should have done that before, but there are a lot of these people that you laid off because you had to save money. And if somebody else starts spending money before you do, they could pick those people up and move them, to their organization. So you could lose some of your, presumably not your best performers, but they are also ripe.
Yep.
If that's the right word, for picking off. If you have a competitor that's being aggressive.
I'm trying to decide if that was ending us on a positive or negative note. I think it's positive because we're talking about fast recovery, although a little bit.
Right, there you go. We'll declare it positive.
Some of your top talent is probably not going to be unemployed very long. That's all we're saying. Thanks, guys. I think it was a great conversation. Those are the kinds of things that the folks that we talked to have been really top of their mind, the kind of things they've been deep diving on. And we're not going to stop with just talking to our friends in the airlines, hospitality, healthcare, and retail spaces. We're going to be doing higher ed coming up, insurance, bank and finance, energy, oil, and gas. If you're out there and you'd like to be involved in some of this stuff, either in one of these meetups or just continue the conversation with us online, you can get in touch with us through our email at coffee@payfactors.com or reach out to us on Twitter at payfactors.com. And we're always watching those and happy to hear your feedback and respond to you in any way we can. Well, thanks, Bill and Matt, for joining us today. Bill, how are we geographically located here? I think we're kind of spread out today.
Yeah, we are more than 6 feet apart. Russ is in the mountains in New Hampshire. I'm in Boston, and Matt's down near the beach, at least. Down on the south shore.
No, I'm not on the beach right now.
I was going to say, can you see the ocean from your house, Matt?
I can see the ocean from my bedroom that I've been sequestered in for the last month plus.
All right, well, have a great day, everyone, and we'll see you next time on Comp and Coffee. Comp and Coffee is a Payfactors production dedicated to the compensation community. We welcome your feedback. Send email to coffee@payfactors.com, tweet us at Payfactors, or share your thoughts in our Payfactors community tile. Until next time, keep your coffee hot and your data fresh.